A resurgence of a preventable threat, whooping cough cases on the rise. This highly contagious respiratory infection, also known as pertussis, is making an alarming comeback, causing concern among healthcare professionals and parents alike. The United States is witnessing a concerning resurgence of whooping cough, a highly contagious respiratory infection. This disease, which was once nearly eradicated thanks to widespread vaccination efforts, is now re-emerging in various communities across the country. This alarming trend has prompted the Centers for Disease Control and Prevention, or CDC, to issue a stark warning, urging parents to ensure their children are up to date on vaccinations. The CDC stresses that timely vaccinations are crucial in preventing the spread of this dangerous disease. Whooping cough, also known as pertussis, can cause severe coughing fits that can last for weeks, particularly in infants. These coughing fits can be so intense that they lead to vomiting, broken ribs, and even hospitalization in severe cases. The CDC has reported a significant increase in whooping cough cases in recent years, with some states experiencing their highest numbers in decades. This resurgence is a stark reminder of the importance of maintaining high vaccination rates to protect public health. This resurgence is attributed to a combination of factors, including waning immunity from childhood vaccinations and the highly contagious nature of the bacteria. Additionally, misinformation about vaccines has led some parents to delay or skip vaccinations for their children, further contributing to the spread of the disease. The CDC emphasizes the importance of vaccination, particularly for infants and young children who are most vulnerable to the severe complications of whooping cough. Vaccination not only protects the individual, but also helps to create herd immunity, reducing the overall spread of the disease. Early symptoms of whooping cough often mimic those of a common cold, making it difficult to diagnose in the initial stages. Symptoms such as a runny nose, mild fever, and occasional cough can easily be mistaken for a less serious illness. However, as the infection progresses, the characteristic whoop sound during coughing fits becomes more apparent. This distinctive sound, which occurs as the patient gasps for air after a coughing fit, is a key indicator of pertussis and often prompts further medical investigation. The CDC recommends that individuals of all ages, particularly pregnant women and those in close contact with infants, stay up to date on their vaccinations to protect themselves and those around them. Pregnant women are advised to get the Tdap vaccine during each pregnancy to pass on immunity to their newborns, providing crucial protection during the first few months of life. Community outreach and education are also vital in combating the resurgence of whooping cough. Public health campaigns aim to inform parents and caregivers about the importance of vaccinations and the risks associated with delaying or skipping them. By working together, communities can help ensure that everyone, especially the most vulnerable, is protected from this preventable disease. The silent pandemic superbugs and the looming health crisis. This is a threat that has been growing quietly but steadily, often overshadowed by more immediate health crises. Yet its potential impact on global health is profound and far-reaching. Antimicrobial resistance, the ability of bacteria and other microbes to evolve and resist the effects of medications designed to kill them, poses a grave threat to global health. This resistance develops through natural selection, but human activities have accelerated the process. The rise of superbugs, strains of bacteria resistant to multiple antibiotics, has raised alarms within the medical community. These superbugs are not just a future threat. They are already causing significant health problems today. These superbugs have the potential to render even the most potent antibiotics ineffective, leading to untreatable infections. This means that routine surgeries, minor injuries, and common illnesses could once again become deadly. The World Health Organization, or WHO, has identified antimicrobial resistance as one of the top 10 global public health threats facing humanity. This recognition underscores the urgency of the situation and the need for coordinated global action. A recent study published in The Lancet estimates that by 2050, drug-resistant infections could claim up to 10 million lives annually, surpassing deaths from cancer. This staggering figure highlights the potential scale of the crisis if we do not take action now. The overuse and misuse of antibiotics in both healthcare settings and agriculture are major contributors to the development of antimicrobial resistance. In healthcare, antibiotics are often prescribed unnecessarily, while in agriculture, they are used to promote growth in healthy animals. Experts warn that if left unchecked, we are on the brink of entering a post-antibiotic era, where common infections could once again become deadly. This would mark a significant regression in medical progress, taking us back to a time when even minor infections could be fatal. The development of new antibiotics has slowed significantly in recent decades, making it crucial to address the root causes of antimicrobial resistance. Pharmaceutical companies have little financial incentive to develop new antibiotics, leading to a stagnation in innovation. Strategies to combat this looming crisis include reducing unnecessary antibiotic use, promoting infection prevention measures, and improving hygiene practices in both healthcare and community settings. Simple actions like hand washing can have a significant impact, and investing in research and development of new antimicrobial drugs. Additionally, global cooperation and policy changes are essential to ensure that new antibiotics are used responsibly and that existing ones remain effective for as long as possible. The fight against superbugs is a collective responsibility that requires immediate and sustained action. Unraveling the double helix turmoil at 23andMe raises concerns. 23andMe, the consumer genetics and research company, has recently been embroiled in internal turmoil, leading to the resignation of several board members. This upheaval has sent shockwaves through the industry, as the company has been a pioneer in making genetic testing accessible to the general public. This shakeup comes at a critical juncture for the company, as it navigates the evolving landscape of consumer genetic testing and data privacy. The industry is rapidly changing, with new regulations and heightened awareness about the importance of safeguarding personal genetic information. The departing board members cited concerns about the company's strategic direction and corporate governance. They expressed worries that the current leadership might not be adequately addressing the challenges posed by these new industry dynamics. 23andMe, known for its direct-to-consumer genetic testing kits that provide insights into ancestry and health predispositions, has faced scrutiny over its data privacy practices and the accuracy of its health-related reports. Customers have increasingly become aware of the potential risks associated with sharing their genetic data. The company has amassed a vast database of genetic information from millions of customers, raising questions about data security and potential misuse. This treasure trove of genetic data is both a valuable asset and a significant liability, as it must be protected against breaches and unauthorized access. The recent board resignations have cast a shadow of uncertainty over 23andMe's future. The company must now work to stabilize its leadership and reassure both its customers and investors that it can continue to operate effectively. Investors and industry analysts are closely watching how the company will address these internal challenges and regain public trust. The stakes are high, as any missteps could have far-reaching consequences for the company's reputation and financial health. The outcome of this situation will likely have implications for the broader consumer genetics industry, particularly regarding data privacy and ethical considerations. As 23andMe navigates this turbulent period, its actions will be closely scrutinized, potentially setting precedents for how similar companies handle such crises in the future. A bitter pill to swallow. Walgreens settles fraudulent billing allegations. Walgreens, the second-largest pharmacy chain in the United States, has agreed to pay a hefty settlement to resolve allegations of fraudulent billing practices. The Department of Justice accused Walgreens of overcharging government healthcare programs, including Medicare and Medicaid, for prescription drugs. The settlement amount highlights the significant financial consequences of healthcare fraud. The allegations against Walgreens involve schemes to bill for medications that were not dispensed, billing for higher dosages than were actually provided, and soliciting and receiving kickbacks from pharmaceutical companies. These practices not only defrauded taxpayers, but also potentially compromised patient care. The settlement requires Walgreens to implement robust compliance measures to prevent future fraudulent activities. The case serves as a reminder of the importance of ethical billing practices and the need for effective oversight within the healthcare industry. Patients and taxpayers alike rely on healthcare providers and pharmacies to operate with integrity and transparency. Rising from the ashes, Rite Aid navigates bankruptcy and looks ahead. Rite Aid, once a struggling pharmacy chain, has successfully emerged from bankruptcy after restructuring its debt and streamlining operations. The company filed for Chapter 11 bankruptcy protection in October 2023, citing mounting debt and competitive pressures within the pharmacy industry. Rite Aid's successful restructuring allows it to continue operating and serving its customers. As part of its bankruptcy plan, Rite Aid closed underperforming stores, renegotiated leases, and reduced its debt by approximately $3 billion. The company also secured new financing to support its operations and future growth. Rite Aid's emergence from bankruptcy marks a significant turnaround for the company. Rite Aid plans to focus on enhancing its digital capabilities, expanding its healthcare services, and improving customer experience. The company aims to differentiate itself in a competitive market by offering a wider range of health and wellness products and services. Rite Aid's journey through bankruptcy serves as a case study in corporate restructuring and the challenges facing the retail pharmacy sector.